Hello, everyone, and thank you for joining us today for SmartChart in Action webinar. My name is Godfrey, and I'm in the marketing department. I'm going to be handing over to Doug, but first, some housekeeping. Anytime during the webinar, if you have any question, please click on the Q&A icon and ask away your questions. If you're using a mobile device, just tap on the screen and a taskbar will appear from the bottom. Click on the Q&A icon and voila. We will be going over your questions in the end of the demo. Also, note that this webinar is being recorded and we will share them with you after. Thank you for joining us. Now over to you, Doug.
Thank you, Godfrey. I want to say thank you to everyone that is joining us today and for taking a few minutes out of your schedule to provide us the opportunity to show you SmartChart. As Godfrey said, my name is Doug McGregor. I'm the VP Customer Success at Winterra Dental. I'm Canadian, so I have to talk about the weather for a minute. We're based in Ottawa, Canada, and the good news is that the snow has finished melting and I'll be dusting off my golf clubs soon. Unfortunately, though, with the amount of snow we received this year, it was record snowfalls in Ottawa. We have had a very large spring melt, and the result has been a very significant amount of flooding. So my heart goes out to those in the Ottawa and Quebec area, actually, that are having to deal with this. But let me tell you, I am looking forward to putting my winter boots away in storage. So enough about the weather. Let's talk about SmartChart. SmartChart is a perio charting software, and it will bridge to many of the existing practice management software systems. And this bridge performs much like the bridge that you might use today for your imaging software. So there's no need to change your practice management software, as we are an enhancement to it. So our unique perio charting software was designed from the ground up to be operated by your voice. Voice activation was not an afterthought for us, it was a driving force behind SmartChart. So a hygienist using SmartChart can now chart on their own as quickly as they would if they had an assistant helping them. So charting allows you to stay focused on your patient's mouth. What we mean by that, there is no more shifting then from focusing into the patient's mouth over to your keyboard, then back again into the patient's mouth. By eliminating this constant back and forth motion, we feel that we are really helping hygienists reduce some of that neck and back strain that they might currently be experiencing. The other thing is that we think we do a really good job of helping to reduce eye strain. Is, you know, when you think about it, you're go from staring into this 4-inch black hole, commonly called the mouth, and then you look over onto a big screen, then back again into this 4-inch hole. It does cause an awful lot of eye strain. The other thing is, you know, by keeping your head down, you just stay focused. And by staying focused, it really allows you to become very proficient with SmartChart. And so that kind of leads us to one of the key questions, and that is, you know, how long does it take to get comfortable with SmartChart? Well, we generally find that with an hour or so of training, you are good to go. It's not a very difficult program to work around, because there's a lot of ingenuity built into the program. So what gets us most excited about SmartChart is what we're hearing from our users. We often hear after a few weeks of use is, quote, "Don't you dare take this away." Using SmartChart really encourages a patient to get more involved in their hygiene care, thus providing the hygienist a better opportunity to have the patient buy into their treatment plan. Working with SmartChart will also make the hygienist more efficient, more productive, healthier, and we think happier. I would now like to introduce you to Tracy Poirier. Oops, where are you? Tracy, there we are. Introduce you to Tracy Poirier. Tracy has over 25 years of experience as a hygienist, and her last 17 years was working with a periodontist. Tracy is now going to show you SmartChart in action.
Hello, everybody, and thanks for taking time out of your precious day. I being a hygienist, I understand how much that lunchtime is so important. So, so I hope you're sitting comfortably and at least able to have a bite to eat and get some sustenance before returning to your 1 o'clock patient. So, thank you, Doug, for that that introduction. As Doug mentioned, I have actually over 30 years of experience in the dental sector. I like to say I was a dental assistant for a year. I was a dental hygienist for 29 and a half years, and I actually stepped into the reception mode for about 3 weeks. So I'm not really good at math, but you can tell which one I was most passionate about. And I did indeed spend my last 17 years working with the periodontal practice. And, much of my time during my 1 hour appointment was spent looking for an assistant to chart. As you know, in periodontal practices, we're doing a lot of that. So what better way than to have your own virtual assistant right at your side? No more leaving your patient, no more running down the hallways looking for someone. So I'm going to shift gears here. We're gonna pull up a new screen. So just bear with me here. And there we go. So are we able to see that screen okay? So as you can see, I have my patient open, and we've pulled up Maria. She's our favorite patient. As you can see, we've done a lot of periodontal exams on her in the last month. But you can see that you can open patient record using the Find Patient button, which is actually down on the lower right hand of the screen. You can either find a current patient or add a new patient. Or if you have a DPMS that has a bridge to SmartChart, you can select the patient in the DPMS and then click on a button, and SmartChart will automatically open that patient for you. So I'm going to be starting to chart on the distal buccal of the 1/8, and I will chart the entire arch. I'm going to use the mouse to put SmartChart into voice mode, and then glove up and do all the charting via voice input. You'll likely hear some beeps, and that indicates that the system has recognized my voice input. The beeps allow me to enter the charting measurements without having to look up at the screen. So we'll get started now. Start. Start. 3, 3, 4, bleeding. 4, 5, swelling. 4, mobility 1. 5, 2, recession 2. 2, 2, recession 2. Recession 2. 5, 4, 4, abrasion 3. 3, 3, 3. 3, 3, 3. 2, 1, 2. 2, 2, 2. 2, 2, 2, 2, 2, 2, 3, 2, 3, 4, 4, 4, 4, 5, bleeding, 5, 5, 5, frication 1, recession 1, bleeding, 6, 5, bleeding, 3, recession 1, 4, 4, 4, 4, 4, 4, 4, 5, 4, 5, bleeding, 5, bleeding, 4, 4, 4, 4, 4, 3, 2, 3, 3, 2, 3, 2, 2, 2, 2, 2, 2, 2, 2, 2, 2, 2, 2, 3, 2, 3, 4, 3, 4, 4, 3, 4, 5, bleeding, 3, 5, bleeding, 5, bleeding, 4, 5, bleeding, 3, 3, 3. SmartChart pause. So as you can see, I was able to chart in an entire arch in less time than I would generally use down to track an assistant to help me. So really a time saver there. So I'm going to take the next few minutes and just go through and highlight the aspects of SmartChart. Right now you can see that the voice input of SmartChart is currently paused. SmartChart can, however, be operated without using voice input with a mouse and a keyboard. So SmartChart can be easily paused, of course, by saying SmartChart pause, or it will automatically pause after about 30 seconds. So this is particularly useful when you are starting a conversation with your patient or perhaps the doctor in the operatory. The other important feature to be aware of is that when SmartChart is paused, it is not listening for a command like some of the other digital assistants like Google Home or Alexa. So if you watch the mouse here, I'm going to just point out some of the aspects. So to the right of the pause button, you can see that this is the microphone training icon. So this is where you would click on that and you would do a voice train. It takes about 6 to 7 minutes to train your voice, and you only have to do this once. To the right is your print icon. You can either print to PDF or to a local printer. And then to the right of that, you can see I'm logged in here currently, and the voice that's trained, of course mine, follows my my login. So for instance, if you're a hygienist that works in different operatories every day for whatever reason, once you log into a different operatory, like 1 or 2, your voice is going to automatically follow your icon. So no need to retrain your voice because you've moved into a different operatory. So the input box, which is this area here, shows you exactly where you are on the tooth. So for instance, right now we're at the lingual, the distal lingual of tooth number 1-8, and then this actually shows you the squares of where it is when you're charting. And of course, to the right of that is all of the conditions that you can place onto the chart. To the left here, if you follow over to the left side of the screen, we're currently in arch mode. Clicking on that, you can either chart an individual tooth in particular, or you can actually just chart a quadrant for whatever reason. There are, of course, several charting sessions that are present. You can see we've done a lot of charting for Maria, and easy to see at a glance if there's been any changes to any of her sessions. Down to the lower left here, you can you have the option to chart implants, or you can click on here and it'll actually skip it. And as you can see, tooth number 1-4 has an implant, and when we click on the skip button, it'll actually skip and not chart any numbers. Now, working in perio, we always charted implants, so we want those numbers to be there. So down to the lower left, you can see who's the patient's chart that I've got open. Of course, you can upload a picture, and then to the right of that, if she had a medical concern, there would actually be a triangle button to let me know, for instance, if she had an allergy to latex and whatnot. To the right of that, you have your medical history, treatment plan, clinical notes. We recommend that if you're using a DPMS system, that you continue to use that aspect, but you can also import files such as medical history and other paper files that you'd be using. So this is just generally a brief overview. If you have any questions, please click on the Q&A box and type them in. Godfrey, do we have any questions right now for us?
Yes, we actually have a lot of questions. Okay, so the first question is, how well does it work with accents? Tracy, do you mind taking this question?
Sure. Actually, not a problem at all. In terms of accents, when you train your voice, it's actually picking up exactly how you were saying it. So any accent that you might have will be picked up beautifully, and you'll be able to use that no problem.
Awesome, thank you, Tracy. The next question is, people are asking, how much does SmartChart cost? Doug, do you mind answering this question?
Absolutely. So the system is set up on a monthly subscription basis. The pricing starts at $150 per month and goes up from there depending on the size of the practice. So the base rate starts as low as $150.
Thank you, Doug. The next question is, can it do only recessions on the central pocket? Tracy, do you mind taking this?
No, I don't mind taking that at all. Yes, in actual fact, I just gave one recession score on the straight buckle, but we know that that recessions are not necessarily approximated across, so you can actually have the ability to chart all three numbers, which is in line with standard of care today.
Thank you. What is the learning curve like on using SmartChart?
Yeah, I can take that as well.
Mhm.
As Doug mentioned, it takes about an hour to input your voice and actually go through a chart and get a feel for it. And like anything that we start new, when you implement something, it takes time and it takes practice. So my suggestion is always to not necessarily jump into the fire with a patient right away. I suggest taking 15 minutes out of your day, whether if it's before you start your day, at lunchtime, or afterwards, to go through a complete charting on a fictional patient, a practice patient. And I suggest doing that every day for a couple of weeks. And then after the couple of weeks is done, set it up where you're picking a patient during the day, perhaps before lunchtime, and it's one of your friendlies. So someone that you know that realizes that you're trying out something new, and so it gives you a little bit more comfort in knowing that, and also before lunch allows you to have that little extra time after the fact, so that you're not rushing into your next client. And I would suggest doing that for another week, and then by that time you should be pretty comfortable with going through on a daily basis.
Wow, thank you. That's great. I got one more question. The last one is, can we use any microphones to do the voice aspect for SmartChart?
Why don't I take that one? Part of our monthly subscription for the when you sign up, we provide you a microphone that has been we've gone through extensive testing to make sure we've chosen the best microphone that works really well with SmartChart. So we don't recommend you go out and buy your own microphone, as we will provide you with a microphone with the initial setup, and we know it's a microphone that works extremely well. In fact, it is quite a high-end microphone, and it is part of the monthly subscription. And part of the fact this microphone works so well is, first of all, it's wireless, but secondly, it has a very unidirectional microphone. So that just means that in a very noisy dental environment, when you've got the dentist working right beside you with the drill, and maybe the other hygienist on the other side of you is working with suction machine and whatever other noise is going on inside the operatory, you can still chart just fine with SmartChart using the microphone that we provide you.
Awesome. Thank you, Doug. That's all the questions we have today. Thank you, everyone, for attending. Now I'll just pass on to Doug to finish up.
All right. Thank you, Godfrey. I just want to thank everyone who attended today's SmartChart webinar. We sincerely appreciate you taking the time to attend, and we ask you to please feel free to reach out to us at any time for more info. Our contact info is on this screen, and I will leave it up for a minute or two. And if your office would like a one-on-one webinar, we are happy to accommodate. We can then cover off any specific questions or concerns that your office may have. And I also want to let you know that we will be in attendance at the ODA in May, the ODA conference. So if anybody wants to drop by our booth, if you've got any specific questions, we can answer them at that time as well. And I do want to also remind you that we will be, as Godfrey indicated earlier on, we will be sending you a link to this recording, so you can share it with other people in your office as well. So thank you again for your time today, and we hope that you have a wonderful day.
Thanks, everybody. Have a great afternoon.